earliest that you can vote is 2:07. That would be the 72-hour rule that was put into place. Then what happens?
We go into debate. We will have a few hours, several hours of debate on the package, the legislative package that will be this health care reform. We'll have a number of votes that take place. The rule vote, of course, which is a procedural vote to actually give us the chance to vote for the real bill. The bill then, when it passes, and I say not if, but when it passes, will then, two things will happen. What we call the reconciliation bill will go to the Senate. The Senate must then debate and pass that, and the bill, the underlying bill, which was passed by the Senate previously, once we pass it, will go to the President for his signature. So one bill with today's votes will go directly to the President once it passes. It will then become law. We will then have in place the architecture for health care reform. The second bill, the corrections bill, to get rid of any special deals, to get rid of anything that we didn't think would work well, the corrections bill then goes to the Senate, completes its debate. If it passes, goes to the President, and then you have that legislative package that becomes health care reform, which puts Americans back on track to getting quality health care and also access to good quality health care.
And that second part, the Senate vote, when will that happen? Next couple of days? Within a day?
Senate's a different body. They have their own rules. Again, they have their own rules, and they have to go through their debate and discussion. I suspect it'll take somewhere around a week for the Senate to be able to get through that process. It's a whole procedural process and its votes to send the President that bill.
And a lot of attention being put forth, the idea by the Speaker, this deem and pass that ultimately did not pass the Rules Committee. Why? What changed?
There are many ways. As I said, the Rules Committee is very open in how it opens the gates to a bill that could change the lives of Americans. And so there are many ways to do this. One way you could do this is to put the bill straight before the members for a vote. Another way, because we have two bills that we're looking at, is to tie them together. And the discussion was about tying the bills together so that when one came to the floor, it was tethered to the other. And by passing one, the one that was tethered would go with it. So you couldn't pass one without passing the other. I believe at this stage what we're going to do is just have a separate vote on each one. Vote one up or down, vote the second one up or down, and then you move. If one doesn't pass, it doesn't go to the President.
We're talking with Representative Becerra from California. Greg is joining us from Jacksonville, Florida. Good morning to you.
Good morning, Steve. Thanks very much. I really enjoy C-SPAN, and this is the very first time I've had a chance out of 30 years I've been watching C-SPAN to call.
Amen.
So I'm very excited to get on the air, and again, I start my day with C-SPAN. I had a comment and a question for Congressman Becerra. The first thing I want to observe, I really tried to get in when Congressman Nunes was on the program, and I took some exception to what he was saying when you first asked him about some of the reports that from some of the demonstrations in Washington against this bill, that the N-word was used. And he sort of justified his comment in saying when there's a totalitarian system, then people have a tendency to get just as aroused, and they use those kind of terms. I really think that, in certainly a decorum and civility, that was unacceptable with his response. The second thing is that a veteran called and indicated too that he was satisfied with his health care, and Mr. Nunes was saying again that there was no free ride, and I'm a military veteran, I'm a combat veteran of Vietnam, and for him to say that there's no free ride to a military veteran who has put on the uniform and sacrificed for this country not only their lives but their blood, I really think is reprehensible. Let me get to the question, Steve, for Mr. Becerra.
Well, let me follow up on those 2 points, Greg, and then we'll come back if you just want to stay on the line.
Okay. I do want to stay on the line.
Sure.
First to Greg, thank you for your service. I really enjoy when some of the veterans call or talk, because this war that we're fighting abroad today in Iraq, Afghanistan, very different from what we faced in Afghanistan in so many different ways. Very different the way we're treating today's veterans coming back from Afghanistan and Iraq than we treated our veterans from Vietnam. And so to Greg, I just say to you, thank you for your service. Thanks for getting through. Amen that you did. Ask us your questions.
Well, but also his earlier point about some of the language being used by protesters on Capitol Hill yesterday.
I find it offensive. There's no excuse for that. And maybe it was a slip of the tongue by some, regardless of whether it was or wasn't. It has no place in this country. It's a free country. We get to say what we wish. I know that. But there's a lot of history behind that, and I don't think there's any excuse that can be given, and there never should be. And I think if we could descend on some of those folks and let them see the ways of this country, they would change their mind about what they think. But they said it, and in this country, they get to say it. By God, they get to say it, but we move forward, and those who were the subject of those kinds of attack continue to rise up. In fact, we have a president of the United States that refutes the kind of statement that was made there by those who said those words.
Greg, back to you.
Mr. Becerra, the question that I had is that I've seen some of the bill. My question is that how are we going to pay for it? And even though I do support the bill, I know there's some huge amounts of funds that's going to have to go into funding part of this health package. So I'd appreciate you giving us a chance, or you certainly explaining how this is going to be funded, in as much that there won't be any new revenues coming in from taxes. How's the bill going to be funded?
Greg, actually, there are going to be some new revenues coming in from taxes, but let me give you the three components of this. First, I think we've all seen the 60-minute reports of the Medicare fraud, the Medicare mills that are out there abusing and exploiting our seniors, overcharging them for a wheelchair, or prescribing medication they don't need, or having them go through multiple tests, MRIs, X-rays, and so forth. That type of abuse adds up to tens of billions of dollars. Some would say even more. In fact, Republican Senator Coburn has said that a third of all Medicare money is wasted. I don't think it's that high, but if that's the case, that's about $200 billion, almost a year that might be wasted. We're going to go aggressively into that. 60 Minutes, we'll do a report in the future, and they'll find that we have extracted that kind of waste and abuse, and people will pay the price for doing that. You get a ton of savings from there, from going after the fraud and the waste. Secondly, we're going to make sure that we have everyone pay their fair share for Medicare. Medicare right now, you get taxed for your benefits in the future for Medicare. There are some people who have income that doesn't get taxed the way yours does for Medicare. We're going to make sure we do this fairly and make sure that everyone is paying their fair share of income to be able to receive Medicare in the future. Next, we make a number of changes to the Medicare system where we save money because, for example, right now there are certain hospitals and providers that receive more compensation than the hospital or insurance company next door. Why? It's just a system that became broken. And so what we're trying to do is level the playing field so that if you're a provider or insurance company, you get about the same amount of money as does a provider or insurance company next door. That saves you, believe it or not, over $100 billion. And so in a $94 billion per year system, out of, by the way, $2.5 trillion, we can find the money. You have to make some cuts. You have to increase some revenue, but you can get there. You make tough decisions when you have to have these very important historical votes take place, but we're going to get there. And at the end of the day, I should mention, we end up saving money because we're making more cuts and finding more savings and adding enough revenue so that at the end of each year, the federal government's deficits actually go down. By the second 20 years, we will be saving over $1.2 trillion by having this bill in place as opposed to having nothing done.
Final question, how do you convince those wavering, undeclared, undecided Democrats to vote today? What will you and others be doing in the next few hours?
It's more, Steve, a matter of convincing them that what I've just said, we're going to save in deficits in the long term. $1.2 trillion will be saved. It's convincing them that there is no federal money to conduct abortions in this bill. It's convincing them that their hospitals, the American Hospital Association, their doctors, the American Medical Association, their organizations that they trust, AARP, are supporting this legislation because it's the right thing to do. Letting them have that comfort that making this monumental change to a system where status quo has prevailed is the right thing to do, because you don't go back. It's like you don't, once you vote for war, you don't go back. Once you vote to impeach a president, you don't go back. Once you decide to get this healthcare system in this country back on track, we don't go back.
Representative Xavier Becerra, Democrat of California, thanks very much for being with us again.
Steve.
Appreciate it.
Always.
We'll continue our conversation on health care and talk with an expert from OpenSecrets.org, and later the latest in the Middle East and our relations with Israel.